Arizona offers a wide range of outdoor activities. That's what makes living in Arizona so great. But what if I told you there's a potentially debilitating and deadly fungus living just within these soils here? It's called Coccidioidomycosis, or commonly known as valley fever. Valley fever is primarily a lung infection, and it's caused by Coccidioidomycosis spores that live inside the soil here in southwestern United States. Those people who contract valley fever often just experience flu-like symptoms, and it usually goes away by itself. But sometimes it can create long-lasting chronic conditions, and it can even spread to bones and joints. Unfortunately, all Arizonans are at risk. Arizona accounts for about 60% of all new cases diagnosed with valley fever. Also, residents of Southern California, Central California, New Mexico, and Northern Mexico are also at risk for developing valley fever. Valley fever affects about 150,000 U.S. residents in the United States each year. About half of those diagnosed were sick for more than 6 months. However, a lot of times people contract valley fever and it goes away by itself. To date, there's no proven way to prevent valley fever. The highest rates of infection happen during springtime and summer months, during dust storms. The best way to prevent contracting valley fever is to avoid being outside during dust storms and windy conditions where dust is blown into the air and spores are in the air and you can breathe them easier. Currently, antifungal treatment is the main treatment for valley fever. Antibiotics don't help because it's a fungus and not a bacteria. Right now, a vaccine is being developed. This will be the best way that anybody can prevent contracting valley fever. But until then, it's important to remember to stay inside during dust storms and avoid being outside during windy weather. I know Arizona is great to enjoy, but contracting valley fever can be a serious and lifelong debilitating disease.